So this is a weird interview.
It is.
A weird interview to do. And I wanted you just on camera because this is about you, but I also wanted to be able to interview you and kind of be the voice for people that may want to ask you questions. I've done this a little bit, so I might be able to think of some questions.
Okay.
Some good ones. My name is Steve Barnes, by the way. I've known Lee for Travis for what, 15 years?
It's been a long time, at least 15 years.
Maybe 15. I never thought I would be sitting here, A, interviewing you, B, interviewing you about cancer.
Mm-hmm.
I can't think of, I could have interviewed you about concrete years ago, but you're pretty boring.
I am.
So I guess it took this to get here, which is not a good thing. And I thought it would be cool for your friends to see you and hear it in your own words, because you're not the traditional cancer patient.
No.
You're just not. And they can look at you right now and they can see that absolutely nothing has changed with you visually.
Right.
So let's now that we've got that out of the way, let's get back and just, for people that may be stumbling upon this, that have been affected by cancer, let's tell them who you are. Just a quick snapshot.
My name is Travis Lee Roberts. I'm 38 years old. I was born April 22nd, 1975. I've got a wonderful wife, Carrie. Started dating her when I was 17 years old. She was 15. Been together, I guess that's 21 years. I got 3 kids, Trey, Piper, and Jake. Almost 6 years old, almost 4, and just turned 2. So 5, 3, and 2. So I own a concrete company. We're doing well, and this cancer just hit us like a train overnight. Changed everything.
So you're a healthy person, you're a fit person going into this. You love stuff like tennis and golf and
wakeboarding, wake surfing.
Stuff. And then one day you wake up and you have one of the most lethal cancers that exists. But you're a walking contradiction, because as you sit here, if I came into the room and you told me you're a stage 4 cancer patient, I would laugh. Why?
Well, the cancer that I have is cholangiocarcinoma, more specifically intrahepatic adenocarcinoma, cholangiocarcinoma. So when you talk about stage 4 cancer patients, there's stage 4 people that can look like me without a disease, but with mine, it's the cousin to pancreatic cancer, which is a tough one. My cancer there's 3,000 patients, 3,000 to 5,000 patients a year with cholangiocarcinoma. It's typically in old people. By the time it gets to stage 4, typically in stage 1, you're jaundiced.
So people twice your age, this is a common cancer for them, and the success rate of living is very low, but you're half their age. Is that part of the, describing why you don't look affected?
No, because even the younger people that get it, which is very rare. And when I went out to MD Anderson, I was the 3rd youngest patient that my doctor had seen, and all she looks at is cholangiocarcinoma. But by the time it gets as advanced as mine, either you're dead or your tumors have blocked the bile ducts, which cholangiocarcinoma is bile duct cancer, and which blocks all your waste. So you would be jaundiced, yellow, sick, fever. There's so many symptoms with it, and for some reason...
And just checking, you are not dead yet?
I'm not dead yet.
Okay. And you won't die?
I believe that I'm not going to die.
It's weird. You joke about it, and that's why I joke about it. We were at Chewy's the other day, and you grabbed the check and said, I got it, I'm dying anyway. Does that freak some people out? I know it wouldn't freak me out, so you say it, but does that freak some people out, the way you're treating this lethal enemy, this lethal devil?
It does. I walk around my office, I walk around, and I don't do it in front of the kids, obviously, but I always talk about dead man walking, but I'm kidding about it, because people, when they look at me, they want to tiptoe around it, and they don't know what to say, and they're nervous about it, and I just bring it out there. I tell everybody what I have. I'm not ashamed of what I have. I have a cancer that is incurable. Cholangiocarcinoma after, I think, stage 2 is completely incurable.
And you're stage 4.
I'm stage 4. And I'm totally, the doctors don't even understand how, if you know the lymph node system, it went from my bile duct to my liver. So I have tumors on my liver. And then typically with cancer, it spreads to the nearby lymph nodes. Well, it didn't with me. It went to my nearby lymph nodes. It went all the way down to my groin, all the way up to my neck. And in most cancers, when it goes in the lymph node system, it drops off in other organs long before it gets that distant. Mine somehow did not drop off in any other organs. It just went distant. So
Random.
I look like, on a PET scan, I look like a Christmas tree. I light up like a Christmas tree.